Good afternoon, Subramaniam sir. Good afternoon, Vijay sir.
A very pleasant good afternoon to all the panelists and participants connected with us. It's a pleasure to connect with you all. So a very pleasant good afternoon to one and all present with us. I hope all of you are doing great and enjoying the period. So we all will just start within a while in a very shorter time period with our webinar. For the information, I would like to tell you that the recorded video of this session shall be available on the YouTube channel of ours at the very earliest by the end of this session. So you all will be shared the details of our YouTube channel shortly on the chat window. I would also request to please ensure that whatever device you are connected with, you have a smooth access to the chat window. I again welcome, a very warm welcome I give to all my panelists and participants who are connected with us. I welcome you all for the today's session. We will just start in a while. I again welcome to all the panelists and participants. I would like all of you to please, I request that please ensure that you have a smooth access to the chat window so that there is no problem in communicating for the whole session. A very pleasant good afternoon to all the panelists and participants connected with us. It's a pleasure to connect with you all. So we all are here. We have joined together for today's session on the topic varicose veins, a walking nightmare. We will soon be starting with our session for the day. So within few minutes from now, we will have our experts on board giving a brief about this session. I would like to request you all to kindly ensure that you all can access the chat window from the device you are logged in for the smooth communication. I repeat that chat window is an important mechanism through which we all will be communicating during this webinar. So any questions you will be having, you can raise them on the chat window. Any questions you will be having, you can raise them on the chat window. I shall be facilitating you by asking those questions at the end of the session. I also request you all the participants that we will be sharing a feedback form link on the chat window for the auto generation of participation certificate for today's session. The same will be shared at the end of this session. So I request you all to ensure that you all are connected with us till the last of the session and you own yourself a certificate of participation for this session. Despite it also will help you for increasing your knowledge. I welcome Professor Huda sir. Very good afternoon, sir.
Good afternoon to you, Ayushi. Good afternoon to
Good
everyone.
afternoon, sir. Good
Professor,
afternoon.
ready?
Yes,
Can
sir.
you hear me?
Yes, sir, you are audible.
Yeah. Acha beta. So welcome to everyone, those who have joined the program. And Professor Reddy, can you hear me? It has been a long time talking to you. Professor Reddy, the former national president of IET and the past president of IET, is from Mumbai, joining our program.
Okay. Very good afternoon, Reddy, sir. Very good afternoon, Subramaniam, sir. I hope you all can hear us. So a very pleasant good afternoon to everybody, to all the panelists and participants connected with us. It is our pleasure to connect with you all, to have you all with us. Very soon, in a very short period of time, we will be starting with the session. I would like all of you to please ensure that you can access this chat window from whatever device you are logged in for the smooth communication. All the information, that is the feedback form for the auto generation of the certificate, will be shared on the chat window itself. Very warm good afternoon to everybody present with us, connected with us. So I welcome you all for the today's session on the topic varicose veins, a walking nightmare. So our expert for today's session will just join us shortly, and we'll start within a period of time. So within this few minutes from now, we will be starting with this session. I request you all to please check that you have a smooth access to your chat window, as chat window is an important mechanism through which we all will be communicating for this webinar. Also, all the questions you will be having will be taken at the end of this session, and I will be facilitating same from your end from the chat window itself. I request all of you to please be connected with us till the end of this session, and the feedback link would be generated or shared with you on the chat box for smooth auto generation of the certificate. So kindly be connected with us till the end of this session, as it would also help you increasing the knowledge about the same. Very warm good afternoon to all the panelists and participants connected with us. I repeat that the recorded video of this session shall be available on our YouTube channel at the earliest by the end of this session. And the details of our YouTube channel will be shared on the chat window itself. I would like to request you to please ensure that you have the access to the chat window, as it would only be the medium for the smooth communication for all through the session. A very warm good afternoon to all the panelists and participants connected with us. It is our pleasure to be connected to you all. So I welcome you all for today's session on varicose veins, a walking nightmare. Our expert for today's session, Dr. Achanthya Sharma, will join us shortly in a while. So within few minutes from now, we'll be starting with this session. Dear participants, whatever device you are connected through for today's webinar, kindly ensure that you all can access the chat window from the same. I repeat, the chat window is an important mechanism through which we all will be communicating during the webinar. So any questions you will be having, you can write that on the chat window. I shall be facilitating you by asking those questions, but at the end of this session. I also request all the participants that we will be sharing a feedback form link on the chat window for automated generation of the participation certificate for the today's session, and it would be shared at the end of this session. Dear participants, please ensure that you are connected with us till the last of the session as you own yourself a certificate of participation. Good afternoon, Subrata sir. I welcome you for the session. Very good afternoon, sir. Hope you are doing
Good
great.
afternoon to everybody, whoever have joined or yet to join.
Good afternoon, Subrata sir.
Good afternoon. What about the speaker?
He'll
Yeah,
join
he's
us
joining.
shortly.
He's joining.
Shortly joining.
Sir. Yes, sir. I welcome you, sir. Good afternoon to all the panelists and participants who all have taken out time and are connected with us. It is a pleasure to have you all and connect with you all. So for the today's session, I welcome you all. The today's session is on the topic varicose veins, a walking nightmare. And the expert for today's session is Dr. Achanthya Sharma, who will join us shortly, and we will start within few minutes. Dear participants, kindly ensure that whatever device you are connected with you have a smooth access to your chat window, as whatever communication we will be doing would be done through the chat window. And I repeat, the chat window is a smooth mechanism or an important mechanism which would help us to communicate with you easily throughout the webinar. Any questions, if you will be having, you can post them on the chat window. I shall be facilitating the same at the end of the session. I also request you, dear participants, that you will be shared a feedback link form on the chat window. So kindly stay connected with us till the end of this session, so that you owe yourself a certificate of participation for this session. Thank you all.
Subrata sir, in our team, we have added Ayushi in the webinar team.
I could see
Along with
her for the
along
second
with
time.
Dr. Ritika.
Earlier, she
Ji.
was there along with Ritika.
Correct. Dr.
Yes, sir.
Ritika.
Yes,
Dr. Ritika is today in the classroom. So we thought that keep 2-3
Okay.
teachers so that if someone is in the classroom, someone has some problem, at least the second or the third person is ready. She has joined us in journalism department.
Okay.
Dear participants, the recorded video of this session shall be available on our YouTube channel at the earliest by the end of this session. The details of the YouTube channel will be shared on the chat window. So I would request you all to please ensure that you have smooth access to your chat window. I repeat, dear participants, the recorded video of this session will be available on the YouTube channel, on our YouTube channel at the earliest by the end of this session. The details of our YouTube channel will be shared on the chat window. So for the same, I would request you all to please ensure that whatever device you are connected with, you have a smooth access to the chat window, as it is an important mechanism of communication. Your questions for the seminar or the session would be taken or facilitated from the same medium. Kindly ensure a smooth access to the chat window. A very warm good afternoon to all the panelists and participants present here connected with us. I welcome you all for today's session. The topic for today's session is varicose veins, a walking nightmare. Our experts for today's session, Dr. Achanthya Sharma, will join us shortly and we'll be starting with the session within few minutes. So dear participants, kindly stay connected with us. A very warm welcome, pleasant good afternoon to all the panelists and participants connected with us. It is a pleasure to connect with you all. So the topic for today's session is varicose veins, a walking nightmare. We'll shortly be starting with our session. Our guest for today's session, the expert for today's section is Dr. Achanthya Sharma, who will join us shortly in a while. Till then, I request you all to kindly check the smooth access of your chat window as all the communication will be taken over there.
Dr. Saab is facing some technical problem. Mr. Uttam is trying to resolve his problem. So once it is resolved, then he will join.
Dear participants, I hope all of you are connected with us smoothly. You all can find our details on the chat window. For a check, I think you should check once the chat window whether you are receiving the information. For the smooth access for all through the seminar, I request you all to check the smooth access of our chat window, as it would be only medium that would help you all for generation of the certificate also. At the end of the session, a feedback link form will be shared on the chat window itself, and the automated generation of the certificate would be possible once you fill in that feedback form.
By the time expert joins, I will request the participants to keep sharing your name, your city, your affiliation so that the networking is done. You can share that in the chat window. Through that, you will also come to understand how to use the chat window. So keep writing in your chat window.
I request all the participants to please connect with us through the chat window. Please share in your information, your name, your city, so that there is a smooth access for the chat window. We are soon trying to resolve the problem, and soon our guest and expert for the day will join us shortly, and we'll be starting with the webinar. A very warm, pleasant good afternoon to one and all present here, to all the panelists and participants who have taken out time and connected with us. I request you all to please stay connected with us. We are just starting with the webinar shortly. For the smooth access of all through the seminar, I request you all to kindly check the smooth access of your chat window. As it would be only medium that would help us help you all for generation of the certificate also. At the end of the session, a feedback link form will be shared on the chat window. For the information, I would like to tell you the recorded video of this session shall be available on our YouTube channel at the earliest. The details of our YouTube channel will be shared on the chat window. I would like to request you also to please ensure that whatever device you are connected with you have smooth access to your chat window. I would request all the participants to please share your information, your name, your city on the chat window. For better networking.
ये जो पूरा अगर इसे आप
A very warm good afternoon to all the panelists and participants who have taken out time to connect with us. I welcome you all to today's session on varicose veins, a walking nightmare. Our expert for today's session, Dr. Achanthya Sharma, will join us shortly. So we'll start within few minutes from now. Dear participants, for your information, I would like to share that whatever device you are connected through for today's webinar, kindly ensure that you all can access the chat window. If you all can access the chat window, I would request further to please share your details, your name, your city, so that we have a proper networking. Kindly ensure that the chat window is smoothly accessible by you all, as it is the only mechanism and an important mechanism through which we all will be communicating during this webinar. So any questions you will be having within the webinar, you can put those questions on the chat box. I shall be facilitating you by asking those questions, but at the end of this session. I also request you all participants that we will be sharing a feedback form link on the chat window at the end of this session. So for the automated generation of the certificate, you all are requested to please stay connected with us till the end of this session. Once you fill in that feedback form, your certificate will automatically be generated on your registered ID.
Well,
Dr. Saab is here.
Okay. So we have our expert for today's webinar.
Dr. Saab, can you hear us? Good evening to you.
So
Your
please
voice is
unmute
not
yourself.
coming. We are unable to hear you, Dr. Saab.
are you able to hear me?
Yeah, now,
Yeah.
now we are hearing you.
So shall I
To keep
start,
you
sir?
guys, yeah, we can start, but there is some issue with the connectivity slides. So can I
Slides I
start?
have requested, yeah, slides I have requested Mr. Vijay to send to either my email or WhatsApp. We will be sharing
Okay.
slides from our end.
Fair enough. Fair enough. So do you want me to start? Go ahead and start the topic.
Hi, we will be starting this program a little around 10-15 minutes. Introductory notes
Fair
are there. Meanwhile,
Fair
I will take slides from Mr. Vijay and our team will share it from our side.
Okay. So I would like to just start by giving a brief introduction about myself.
Just a
Sir,
minute.
I'll
Sir.
facilitate.
Little beginning because this webinar is under collaboration with many professional societies and
Okay,
heads of
okay.
many professional societies are here. At least one or two will speak on this occasion, and we'll welcome
Great.
you. We'll welcome the participant, and then we'll start. So, Ayushi, you may please start it, please.
Sure, sir. So a very warm good evening to all the distinguished panelists and participants. Bharti Vidyapeeth Institute of Computer Applications and Management, in association with Computer Science Chapter of IEEE Delhi Section, Consultants Network Affinity, Group of IEEE Delhi Section, Life Member Affinity, Group of IEEE Delhi Section, Inter-Society Relations Standing Committee of IEEE Delhi Section, Industry Relations and Site Standing Committees of IEEE Delhi Section, with the associations CSI, Safa Society, ISTE Delhi Section, and IETE Delhi Center, welcomes you all to this webinar on varicose veins, a walking nightmare. According to Dr. Cynthia Shortell, up to 25% of women and 15% of men will develop varicose veins. While there are many causes for the condition, varicose veins occur most frequently in the obese, in women after pregnancy, in the elderly, and those who stand for long period of time. There are also times which appears to be genetic component as well. This quote indicates how prevalent and common this condition called varicose veins is today. This webinar today is aimed at highlighting how dilated veins are easily seen along the legs, and almost half of the population suffers from this problem. It can also lead to heaviness, cramps, and swelling. If not treated, it can lead to bleeding and ulcers. So for pain-free legs, basic awareness and knowledge, required preventive care, and in emergency, consultation with the vascular surgeon is important. This webinar today will discuss all-round perspective of the same. I would first take this opportunity to welcome amongst us all our distinguished panelists for the day. Very good afternoon to all of you. We are privileged to have amongst us a galaxy of experts. So we have Professor Subrata Mukhopadhyay, Chairperson Consultants Network Affinity Group and former Chairperson IEEE Delhi Section. I would request Subrata sir to please commence this session with his welcome address.
Thank you, Ayushi. Glad to be present in a webinar, little bit on a different platform.
Yes.
Rather, the platform remaining same, the topic is somewhat different, but definitely much important. I have come across this one with very near and dear ones, and I know that how she used to manage this issue by putting some tights and all these things even at a later part of the life. So definitely this is a nightmare to those who suffer. Fortunately, we want people should not suffer, and we will hear from the doctor present today to advise what are the precautions to be taken, and with the female portion more likely to have this type of disease or whatever is said. And of course, I came to know, I was knowing that males do not suffer, but at least IUC has given some percentage that they are also likely to. So one has to be cautious actually on this aspect. Anyway, treatments are there. Definitely, I could see it. Not only medicines, even exercise, yogas, and all these things are. Let us hear from the physician, whoever Dr. Sharma is present today. Will be definitely delighted to have in our forum, because earlier we have taken from the people from the medical discipline on COVID-19, or later on whatever the Omicron and other aspects. This is also, it was earlier also there, maybe in future also, but if we take a preventive measures, probably we can escape from such sort of things. Over to Ayushi.
Thank you so much, sir. We hope to have an inspiring session. I now request Professor M.N. Huda Sir, Director, Bharti Vidyapeeth Institute of Computer Applications and Management, to address the participants with his inspiring words. Please, sir.
Good evening, everyone. I take this opportunity at the outset to first welcome our today's valued speaker, Dr. Achanthya Sharma, the senior consultant and in charge of vascular and endovascular surgery, Max Super Specialty Hospital, Shalimar Bagh. And for this, the credit goes to my friend, Mr. Vijay, from the same Max Healthcare Services. Friends, I also take this opportunity to welcome all my friends from various professional societies, IET, IST, CSI. I'm getting messages from Mr. Vyas that he's not able to switch on the video or talk, some problem in joining as panelist, but he has joined as an attendee. We will resolve this problem. So my all friends from various professional societies, I take the opportunity to welcome them all. And of course, the participants from different parts of the country and abroad. While going through the list of the participants, I was seeing that there are participants from Chennai, from Mumbai, from Kerala, from Bhubaneswar, from Puri, from West Bengal, Palghar, North India, Central and North India, where we are. So from different parts of the country and abroad. In fact, this topic was absolutely different, and purposefully we kept it different than what the series under IEEE and Delhi section and Bharti Vidyapeeth we had launched around close to 1.5 years ago during May 2020 in the backdrop of COVID-19 first phase. Why? Because we need to keep ourselves fit. We need to keep ourselves healthy. We need to understand what are the problems or where can we go wrong and in which way it can start giving trouble to us. And that's how it is said that if we wanted to keep our leg pain-free or otherwise if we keep ourselves healthy, we have to undertake few preventive cares. And for that purpose, in past also 2-3 such webinars from medical professionals we have organized, and this is one of them. It is said that healthy people makes happy society, happy family and happy society, and happy society and healthy people in which they are healthy people will only make the progressive nation. If we want nation to progress at a better speed, then probably the people residing in the nations have to take care of their health related issues. Because if we are not fit medically, if we are not healthy, probably we may not get time to contribute to any other constructive purpose. And that's how this has been organized. I'm not a doctor of medical profession to tell you the topic, the way we keep on deliberating on the topic or on the background of the topic, if it is from technology side, if it is from engineering sciences. But yes, the brief introduction as an introductory note that why this program has been done, Ayushi has already introduced to all of you. My message to all of you that we have just declared that Corona is over and almost the life is coming back to normal, and we are very happy to see people behaving in a normal way. And the life is coming back to the campuses also. Students, teachers, staff members are coming to the institutions. The market is full of कहते हैं रौनक आ गई है मार्केट में. Market is full of glamour. But on this note, earlier I used to say that वक्त नाजुक है, जरा संभल के रहिए. वक्त नाजुक है, जरा संभल के रहिए. जब तक न हो बहुत जरूरी, घर के बाहर ना निकलिए. लेकिन अब तो घर के बाहर निकलने की इजाजत दी गई है. So once the permission has been given, my request to all of you will be to take all preventive care, to take all preventive steps to follow the COVID appropriate behavior while going out of home at a public place, so that the reopening process, which has just been started around 2-3 weeks ago, could be a sustainable and can continue for longer duration of time forever, and we could finally say goodbye to the COVID environment. If we do not undertake all these preventive care, probably we do not know what will happen in future. The experts are alarming. Experts are indicating that fourth wave might come. So let's behave in a way which is appropriate, considered as appropriate related to COVID, what is said as COVID appropriate behavior. And that's how I keep on saying now that ये पैंडेमिक की परछाइयाँ हैं, ये पैंडेमिक की परछाइयाँ हैं, न यूं मचल के चलो, मीन्स बिना मास्क और बिना अप्रोप्रिएट रिस्ट्रिक्शंस के न चले हम अभी भी मार्केट या पब्लिक प्लेस में. सो ये पैंडेमिक की परछाइयाँ हैं, न यूं मचल के चलो, लगी है पैरों में कोरोना की बेरियां, जरा संभल के चलो. तो शायद हमें अगर एक दो महीने और अच्छे से गुजर गए और फिर धीरे धीरे चीजें नॉर्मल हो गई तो शायद ठीक होंगी. आज की ये शाम इसलिए है कि हम सबको ये समझ में आ जाए कि विद ग्रोइंग एज प्रॉब्लम्स आर बाउंड टू कम, बट इफ वी अंडरटेक प्रिवेंटिव care, if we undertake preventive steps, probably the magnitude of that problem can be reduced, if not completely solved. And for that purpose, we have invited none other than but a practicing doctor, head of this department from Max Super Specialty Hospital, and it will be his show today to enlighten us that how, in which way we should take preventive actions, and if by any means any one of us is part of this problem, then how to get rid of this problem. Thank you so much. Wish you all the best. Stay safe, stay healthy, stay vibrant. Keep learning despite disruptions all around us, and ensure that while going out, follow all COVID appropriate behavior. There are many webinars which have already been notified on our portal. The link of the same has been shared in the chat window, will again be shared. I will request all of you that if you have not registered by now, please register so that you can derive maximum benefit. This entire effort of IEEE Delhi section and BBICAM through this webinar series is to ensure that fellow colleagues, fellow professionals from different parts of the country and abroad should keep themselves busy in learning process. Disruptions, negativity in the society should not create negativity in ourselves. Thank you so much. All the best. Over to you, Ayushu.
Thank you so much, sir. Your message was really inspirational and deliberated in a very nice manner. I would now welcome amongst us our expert speaker for the session, Dr. Achanthya Sharma, consultant and in charge vascular and endovascular surgery, Max Super Speciality Hospital, Shalimar, Delhi. Dr. Achanthya Sharma is a renowned vascular surgeon with an experience of more than over a decade. He has a professional membership with Delhi Medical Council and is a life member of Vascular Society of India. His areas of interest include complex dialysis access, venous work, and varicose surgery, aortic endovascular work, and peripheral endovascular interventions for gangrene, non-healing ulcers of foot and leg, aortic aneurysm, thoracic aneurysm, central vein obstruction, and mesenteric ischemia. I welcome you to this session, sir. I would now request you to please enlighten the house. Please, sir.
Good evening, everyone, and invited at such a good podium. And I would like to begin my talk by saying that varicose vein is a very common problem and a very neglected problem. So I would say that we should all love our legs. And varicose vein, as you all know, what is varicose vein? Varicose veins are basically abnormal tortuous veins which are caused by which are basically tortuous superficial vein caused by incompetent venous walls, most commonly seen in the lower extremities. So we need to understand one thing, that varicose vein is not limited to lower limbs. It can be in any part of the body. Even in the upper limb, you can find varicosities. The treatment protocol for all these veins is little different. Today, our talk is limited towards the lower extremities, but I would like to tell you guys that in lower extremities also and veins, this problem is commonly seen in upper limbs also in patients with super SVC obstruction. As you all know that superior vena cava is a blood vessel which supplies the heart, and there can be obstruction in the central veins which can lead to dilated veins in the upper limb also. Now talking about the venous anatomy of the lower leg. As you know, there are two venous systems in our lower limb, which is a superficial venous system. It is divided into two, a great saphenous vein, which is the longest vein of the body and which is the main cause of varicosities in our body. So you need to understand two things, that this venous system supplies along the medial side of the leg, and these varicosities are commonly seen towards the medial side of the leg. The short saphenous vein, which supplies the lower part of the leg, is commonly seen behind the leg. So if you talk about how this supply is there in the body, so the question is how we get this supply. If we get a clot in the deep veins, you understand that we have deep venous thrombosis. Superficial veins are towards the skin and deep veins are towards the muscles. There are multiple walls which connect the deep veins with the superficial veins, and the function and the flow of this blood supply is unidirectional. That means it flows in one direction. It is not bidirectional. If the flow becomes bidirectional, then you tend to develop वेरिकोज वेन्स. सो हिंदी में बेसिकली समझने की बात यह है कि वेरिकोज वेन्स जो होती हैं, टांगों में सूजी हुई नसें हैं. जो हमारी गहरी नस होती है वो सुपरफिशियल नस को, जैसे हार्ट में वॉल्स होते हैं, टांगों में वॉल्स होते हैं, दैट कनेक्ट्स आवर ब्लड इन द venous system. अगर ये वॉल्स खराब हो जाएं तो ब्लड कीप्स ऑन पूलिंग इन द सुपरफिशियल वेन्स एंड वी टेंड टू डेवलप वेरिकोज वेन्स. So these walls, there are three walls primarily seen in the foot. One is at the ankle, one is at the calf, and one is at the thigh. The main function of this calf muscle pump is to pump the blood when you are walking and doing some activity. जैसे ही आप चलते हैं, भागते हैं, blood goes towards the superficial venous system. When you lie down, it comes down towards the deep venous system back and the walls closes. If these walls becomes dysfunctional, the blood supply will be towards the skin and you will feel that you have heaviness in the leg and cramps. So what are these perforators? We have perforating veins also. Perforators are basically small channels which connects the deep veins with the superficial veins. In these perforators, as you can see in this above diagram, there are walls. When these walls becomes dysfunctional, you tend to develop varicose veins. As I have already discussed, the calf muscle pump, which is the primary mechanism of action in your body, which pumps the blood. Relaxation draws the blood from the deep to the superficial, and when you run, आप भागते हैं तो ये contract करता है calf muscle pump. So the important thing is that the main function of this pump is primarily at the level of the calf muscle, which carries the ejection fraction of almost 45%. मतलब आपकी टांगों का 45% of the blood in the veins is carried by the calf muscle pump action. So if you talk about etiology, varicose vein runs in the family. Multiple family members में आपने problem दिए, it is commonly seen. It is more common in females. Lack of exercise, sedentary lifestyle can lead to varicose vein. If you are not walking, you are obese, you tend to develop varicose vein. Hormonal medication. So you need to understand that oral contraceptive pills has a high risk of causing DVT. अगर आपको DVT हो जाता है, then it causes central venous obstruction. Central veins obstruction, I means not the superficial venous system, but आपकी deep veins, जो main veins होती हैं वो block हो जाती हैं. That can lead to opening of multiple channels. You have to understand कि अगर आपका main ऊपर का channel block है, तो blood has to go through sideways. So multiple small varicose vein will open up. Then surgery or trauma. Any surgery which can lead to damage to veins can lead to development of varicose vein. Pregnancy. Pregnancy itself is a major cause factor for varicose vein. Pregnancy causes pressure over the central veins, which can lead to multiple dilated veins in the lower extremity. So you need to understand that post-pregnancy varicosities will resolve. During pregnancy, कोई varicose patient develops varicose vein doesn't require surgery, just basic compressive therapy. It is now you need to understand more etiology. Age more than 40 years, it is a lifestyle disorder. Varicose vein is a lifestyle disorder. I'm again emphasizing this fact that veins have a tendency to become redundant over a period of time. जैसे जैसे हमारी उम्र बढ़ती है, veins tend to dilate, but you need to take a call whether this patient really requires surgery or he doesn't require surgery. Jobs requiring us to for prolonged standing and sitting hours. So we need to understand that by prolonged standing, especially guards, professors, as I'm already talking in Bharatiya Vidyapeeth, you tend to be people who stand for long hours. I have a tendency to develop varicose vein. So how do you classify varicose veins? we need to know that there is a certain classification of varicose vein. Stage 0 means no veins. You don't have any veins at all in your body. There are no dilated veins. Telangiectasia and reticular veins. Telangiectasia means veins अगर वो 1 mm के से small हैं, that is called telangiectasia. Reticular veins are 1 to 3 mm. Technical definition of varicose veins is that varicose veins are veins more than 3 mm. Next stage, over a period of time, say year or so, you tend to develop edema. It is commonly seen in females. Females who wear shoes, after 6 to 7 hours of wearing shoes, you will tend to have swelling in the एक ये important fact है which we need to understand कि भाई this should not be avoided. If you are having swelling in the lower limb, after 6 to 7 hours, you tend to develop varicosities, skin changes. So एक चीज आपको ये भी समझना जरूरी है, skin changes किस पेशेंट में आते हैं. If you are having venous hypertension towards the wall, as I have already told you that varicose vein is a superficial venous disorder. तो स्किन के पास होती हैं जो superficial veins, the pressure increases towards the skin. So as you know, when water pressure increases towards any part of the wall becomes thinned out. Same way, you develop skin changes. So what are these skin changes? Skin changes are blackish discoloration of skin, liposidrin. There is a proper content, liposidrin, which gets deposited towards the skin, and you tend to develop browny induration. Healed ulcer. We get patients in a lot of advanced stages because patients tend to neglect this problem. People don't take varicosities seriously. So we develop ulcers, active ulcers. You will see that varicose vein के patients are going to skin OPD, multiple उनकी dressings हो रही हैं, they are not being treated. So you need to rule out the underlying cause. Underlying cause can be varicose vein. Active ulcer, non-healing ulcer. Active ulcer is an advanced stage of varicose vein. You need to understand one thing कि अगर patient हमारे पास healed ulcer और active ulcer stage में आ रहा है, तो इसका मतलब ये है कि we have already crossed the threshold. To gain 1 mm or 2 mm of skin, it takes 3 to 4 months for it to heal. So it will go on to heal around a year or so. So why wait for such a long time? So as I have already told, stage 0, no varicose. So this is what you call stage 1 of reticular veins. Stage 1 reticular veins are classically seen behind the knee. Small veins are seen. Stage 2 is advanced varicosities. As you can see in these diagrams, stage 2, you are seeing dilated tortuous vein. We are seeing along the medial side of this vein is towards the GSV territory. So the great saphenous vein runs along the medial side of the leg. Stage 3 edema. पैर में swelling होना, सूजन होना, post wearing shoes, you tend to develop varicosities. Stage 4, skin changes, browny discoloration because of lipid gets deposited in your skin. You tend to develop these skin changes. Healed ulcer. This is a vicious circle. मतलब आप पेशेंट को दवाइयां दे रहे हैं, heal हो रहा है ulcer, it is not getting healed, then the skin again breaks away. So this is all because of varicosities. Active ulcer, multiple ulcers are seen in the lower limb. So signs and symptoms. Every varicose vein doesn't require surgery. पहले हमें ये समझना जरूरी है कि हर varicose vein के पेशेंट को सर्जरी की जरूरत नहीं होती. आपको ये बहुत जरूरी है बात समझना, क्योंकि lot of people have this mindset या उनके दिमाग में होता है कि varicose की surgeries are not successful. So ऐसा नहीं है. 90% success rate is there for varicose vein surgery, but you have to differentiate whether it is a vasculogenic pain due to varicose vein, neurogenic pain. So what is vasculogenic pain? Varicose vein का पेन कैसा होगा? पेशेंट का पेन जो होता है, it becomes increases during the day. It is not relief. It is a continuous crescendo. Dull aching continuously plain होता है इसमें. Neurogenic pain, which occurs due to nerve compression, causes tingling, numbness. Pain is radiating from the back towards the leg. That is a different pain. Restless leg syndrome. One problem which people confuse with varicose. What is restless leg syndrome? Restless leg syndromes, cramps. These are commonly seen in vitamin deficiency, vitamin B12 deficiency. You need to differentiate these problems. Otherwise, treating varicose vein is not going to be helpful. So status dermatitis and eczema. As I've already told you, varicose vein is basically venous hypertension. Venous hypertension tends to, अगर पानी का pressure एक wall पे बढ़ता जाएगा, तो it breaks away the wall. So we develop statitis, dermatitis, and eczema. So what are the investigations which are really, helpful to identify varicose vein? Varicose veins are commonly done by a basic simple examination, what is called a venous Doppler. Doppler is basically an ultrasound where we examine both the deep veins and superficial veins to rule out reflux and obstruction. So why reflux and obstruction? Varicose vein, you need to understand. Varicose veins are superficial vein. Varicose veins, superficial vein, the great saphenous veins joins the common femoral vein, which is a deep vein in the thigh. So we need to rule out the reflux. What do you say a reflux? How do you rule out a reflux? So basically, first you need to understand Doppler is done in a standing position. You compress your leg, and if the veins flow is bidirectional, as I told earlier, unidirectional flow is the vein. Veins आपकी कभी एक direction में ही flow करेंगे, not in bidirectional. अगर reflux हो रहा है, उल्टा बह रहा है, more than 0.5 seconds, then you have definite varicose vein. What is obstruction? So obstruction, as I told earlier, deep venous thrombosis. Deep venous thrombosis, आपकी central veins block होती हैं, then it leads to dilated veins, varicosities. पानी का ऊपर का कहीं ब्लॉकेज सेंट्रल वेन्स में ब्लॉक होंगी तो मल्टीपल चैनल्स विल ओपन व्हिच कैन लीड टू डायलेटेशन एंड स्मॉल वेन्स. सो इफ यू रिलीज दिस ऑब्स्ट्रक्शन, वेरिकोज वेन अपने आप रिलीव हो जाती है. यू विल फाइंड मल्टीपल पेशेंट्स जिनकी हमने सर्जरी तो करती बट दे टेंड टू डेवलप रीअकरेंस ऑफ वेरिकोज वेन. सो देयर यू नीड टू रूल आउट सेंट्रल venous obstruction. Now if you talk about treatment, we have advanced over the last 15 years. We have advanced. If you talk about the traditional treatment, surgical ligation and stripping, which was done 15 years back, surgical ligation is still the gold standard. If you talk about gold standard, it is still the gold standard. Surgical ligation means आपने open surgery करी, you cut open the vein, ligate it at the top and below and strip the vein, putting a stripper. This surgery becomes very crude, cosmetic issues, multiple small incisions are seen in the leg, and as you know, it is more common in females. They tend to, create a lot of cosmetic issues. High ligation. High ligation means you open the vein in the groin and ligate the great saphenous vein. Plebectomy, we still do plebectomy. Veins more than 6 or 8 mm in size, we hook the vein and cut it out. Now, if you talk about advances, we have advanced in last 15 years. Now, this classification is classified into two topics: thermal ablation and non-thermal. Thermal ablation means we are burning the vein. So endovenous laser ablation and radiofrequency ablation are thermal procedures. Glue closure devices and foam sclerotherapy are non-thermal procedures. Endovenous and radiofrequency ablation. Now I will discuss a little bit about endovenous laser ablation and radiofrequency ablation. Endovenous laser ablation, we use a laser fiber and we puncture the great saphenous vein below knee at the level of the thigh and put a fiber which goes up to the great saphenous vein junction, SFJ. It is kept 2 centimeters beyond the SFJ junction so that we don't enter the common femoral deep veins mein na jaye. Otherwise, if you burn a deep vein, there is a tendency of a complication of developing deep vein thrombosis. Radiofrequency ablation, here we use a radiofrequency fiber, which is a microwave fiber, which goes all around the vein, and circumstantial radiofrequency ablation we do. So, I mean, if you remove the technicalities, basic crux is that, okay, what is the success? So success, these surgeries have been, this thermal has been for last 15 or 20 years. And the advantage of this surgery is that the closure rate is 90%. All studies, whether Western or Indian literature, if you talk about it, is 90%. Provided you do ultrasound guided and you identify the great saphenous vein SFJ junction. Glue closure devices and foam are the latest, which have been in last 2-3 years. And talking about our centers, we have a very high output center and we have been doing a lot of glue closure devices. Glue closure is basically a cyanoacrylate glue, which we put in the vein and close it. So basic difference, if you need to understand, is that endovenous and radiofrequency ablation are done under spinal anesthesia and glue closure is done under local anesthesia. You come walking with varicose vein We do this procedure and send you home within 1 day. Foam sclerotherapy, if you understand what is foam sclerotherapy, we use chemical substances to block the veins. So basically in foam sclerotherapy, we take a chemical substance known as pilodecanol and cetrol, and we inject in the veins. But there is a high recurrence rate with this foam sclerotherapy. Properly not done, it can even fly off into your deep veins and cause pulmonary embolism. And multiple adverse reactions have happened with this foam sclerotherapy. So what are the advantages of these procedures? Basically, everybody wants to know what are the advantages of these procedures. These are simple procedures. They are not open surgeries where you cut open the patient and patient requires a recovery of 7 to 8 days. Easy to perform. If you have basic idea of an ultrasound performance, can be performed under local anesthesia and sedation. So patient who is compliant with little pain, we go for local anesthesia and sedation. Immediate relief. No ugly scar. So by today's market, everybody wants to know what is best. Everybody wants minimal invasive things. Nobody wants open surgeries. So we tend to avoid ugly scars. It is minimal invasive, very risk of post-operative pain. Patient usually with thermal ablation is able to walk within next 6 hours, and with glue, we send the patient within 2 hours. So if you talk about glue closure, we call our patients in OPD, we examine the patient, get our ultrasound done, identify which is really SFJ junction incompetent, do these surgeries and send the patient home. Foam sclerotherapy. So as I had discussed earlier about foam sclerotherapy, in foam sclerotherapy, this is what is called as a Tisari technique, where you take 1 ml of pilodecanol and mix with 8 ml of air. 20 times you flush it, and under ultrasound guidance, you push this into the veins. But there has to be a caution while using. You cannot give more than 10 ml foam in one sitting. So what are the basic difference between surgery and glue? Surgery requires anesthesia, spinal or general anesthesia, depending upon the condition of the patient, we plan it. Pain, bruising, and scarring requires hospital admission. Glue is done under sedation. It's a daycare procedure. You come in the morning, we send you home back in the evening. So if you talk about reoccurrence rate, difference between surgery and glue, reoccurrence is being noticed as high as 25% in surgery. The problem being that you have to identify each vein and block the vein. That's why this reoccurrence is there, not suitable for elderly, sick patients. You can't do these surgeries. Requires a longer healing time of around 2 weeks is the healing time. If you talk about reoccurrence, the reoccurrence is all in glue is less than 5%. There is no age limit. Even a 40-year can undergo, even a 20-year, even a 70-year. You usually go back to work within next day. So if you compare surgery with these procedures, here I show you a image where we do a surgery of a patient with varicose veins, open surgery we have done. In this, we have taken out the vein and pulled it out. If you go to the next slide, in that you will see that in radio frequency ablation, it is a small puncture which we puncture the vein ultrasound guided, and we push a radio frequency fiber and burn the vein. So if you see, this is one of my old patients. This was a patient. In the next slide, you can see that the patient in this case, this was a patient which had multiple dilated veins along the territory of great saphenous vein, big, huge torches. We did a radio frequency ablation. This patient had to come twice to us. First, we did an axial reflux. Basically, we burned the vein, and then we injected foam in the second sitting after 2 to 3 months. This was the condition after of his vein. Here, this is a patient with advanced venous disease, advanced venous ulcer. This patient was underwent EVLT. That was laser. In the next slide, as we can see, it underwent laser ablation, and after 1 month, the patient had an active healing ulcer. So this was a patient who had great dilated vein in the short saphenous vein territory. We did a EVLT for this patient, and this was the image post surgery. So prevention, we need to understand that not all varicose veins require surgery. if all varicose veins required surgery, then we would be, operating day and night, because every fourth person has this problem. How do we prevent this? Compression stockings. If you have reticular small telangiectasia vein, compression stockings has a very good role in preventing varicose veins. Compression stockings, usually we advise grade 2 stocking who has a pressure of 15 to 20 millimeters of mercury. And this helps in reducing the venous pressure and keeps the fluid or edema fluid within the compartment. So it helps us in both the ways, the lymphatic pressure and the venous pressure. So हमारे को basically understand ये करना है कि भाई venous pressure जो superficial, it keeps the flow into the deep veins. Regular exercise and walking, wearing stocking regularly. This has been, how do you wear stockings regularly? It is not that you have to wear stockings whole during the day. During the night, you can take out these stockings. People who have an activity of prolonged standing, we surgeons, professors, and a lot of the other people should wear stockings. Conclude my talk by saying that varicose vein is an essential part. It is a lifestyle disorder. We can prevent this by being little vigilant, identifying our symptoms, and consulting a vascular surgeon or any a physician who can take care of this problem. Don't wait on it. If you wait on it by just thinking that it is a small problem and it is going to heal by itself, you are neglecting it. It's a tip of iceberg. We need to take care of our legs. So legs are an important part of our parcel of our life. And I would like to conclude this by saying thank you. Thank you very much.
Thank you so much, sir. It was a very wonderful and very insightful, informative session, I must say. I believe that it would have enlightened the participants and given them the deep knowledge and about the intricacies of the varicose veins and its prevention, I must say. So I would like to put up some questions which I have received from the participants. Can I, sir?
Yeah, ma'am, I'm not able to get. Can you just repeat the question so I can answer?
Yeah, I'll take the questions. So the first question we have is, are diabetic patients and heart patients more prone to this?
See, as you know, diabetic patients, and there is no direct etiology that diabetic patients are more prone to varicose veins. Diabetic patients lead a sedentary lifestyle and lack of exercise. They tend to develop varicose vein, but there is not a direct correlation. So if you have varicose vein in a diabetic patient, you need to identify the arterial causes also first, because most of the diabetic patients usually have what you call arterial disease, and they tend to mix it with your arteriogenic problems. Varicose vein can cause central venous obstructions also, so you need to identify other causes also for this. So there is no direct correlation.
Okay, thank you so much, sir. One of our participants is very eager to know about the natural ways to treat this varicose veins.
I think there is some problem in the connectivity. I couldn't get you.
Yeah. Yes, sir. Yeah. One of our participants wants to know the natural ways to treat this problem of varicose veins.
First and foremost, ma'am, there are no natural medications. Daflon was given. Daflon does not help at all. Yes, if you are in stage 1 or 2, say by reticular veins or telangiectasia veins are there, small veins, you should wear stockings. That is the natural way only, I would say, nothing else. By taking medication, it is not going to help you out, or just keep a good healthy lifestyle. That is more than important. Avoid prolonged standing.
Okay. And another, I think, last question I would like to ask you that one of the participants has asked, why are women more susceptible to this varicose veins? If so,
I think the fairer sex is more responsible. Still now, we could not find any correlation. I think God has given females the more, being beautiful females. That's why they are having these problems that God has given them. But as such, there is no direct correlation. But etiology wise, we have not been able to identify any cause why it is more common in females. Only thing it is that it is a genetic predisposition. It is more common in females, nothing else. 40% of females suffer this problem. Okay. Maybe we can say that they are more hardworking than men. That is why.
Yes, prolonged standing, I think, can be a reason for this.
Yeah, that is what is one of the causes.
Okay,
We can
so
say, but there is
I am
never been
continuous.
a direct.
Okay. Am I audible to you, sir?
Yeah.
Ma'am, there is little disturbance here.
Okay. I am continuously getting so many questions are popping up in the chat window. So I would take another question, though I said that would be the last one. So one of our
Please go
participants
ahead.
want to know that if this problem is hereditary. Am I?
So there,
Yes, sir.
I think the question was, is there any correlation bow legs and varicose vein, right?
Sir, the question is that this problem, if this problem is hereditary or not.
Yes, it is hereditary.
Okay.
It has been said that it is hereditary. It runs in families. There have been multiple syndromes which have been identified that varicose vein runs in family. So, in fact, we have treated a female who has this a family. Actually, we have operated 4 members of that family. It has been running in family. There is multiple, Lee Fromenini and there were at least Stevens-Trovny syndrome. I can give the names, but it runs in family.
Okay. So thank you
Yeah.
so much, sir. The really justifying answers you have given to our participants. I would now like to request Professor Huda, sir, to please kindly present a certificate to Dr. Achanthya Sharma, sir, as a token of remembrance. Please, sir.
So, Dr. Achanthya, this topic was so important that everyone should understand how and in which way we need to take preventive care, and if something has happened, how and in which way we need to get it treated. And you have very nicely enlightened all of us that what are different steps and how and in which way we need to know about it. So thank you so much. This certificate is not for the purpose of certification, but for the purpose of remembrance that you have been part of this wonderful webinar in which people out of their curiosity, out of their interest have joined and got enlightened. And services from a doctor is always required. This was just an awareness program to the people. And as and when any one of us needs services, we'll come back to you, maybe in physical mode, maybe in online mode, to get your services, get your expert advice. And thank you so much. I also have here Mr. Vijay, who has been my friend from your team. And we would also like to thank Mr. Vijay for his unending support anytime. As and when I request him, I inform him, immediately he's ready to support us. So thank you so much, Mr.
Thank you so
Vijay.
much, sir.
Thank you, sir.
To you, Dr. Ayushi.
Thank you.
Thank you.
Thank you so much, sir. Thank you so much, Vijay Kumar, sir, for extending great support to us. I really thank you from the bottom of my heart. Thank you, sir. So I would also like to thank all our distinguished panelists and participants who have been continuously supporting us, and they were all patient and supporting us all through this webinar. A big thank you to all the panelists and participants who have joined us on this auspicious occasion. Thank you. I hope this session was really very informative and insightful for you all.
Yeah.
Thank you, sir.
So participants' feedback link has been shared. You may access the link, fill your data correctly, because from the same data, your certificate will be generated. Wait here till you get certificate. If not, my team members are here to give you solutions to resolve your queries. So thank you so much. And Bhatia sir, good evening to you.